Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you for joining us. In studio, we have with us Mr. Richard Carreon, Managing Director and Chief Executive Officer, ImpediMed. And he's joining us on the program to talk about SOZO. Welcome to the program, Richard Carreon. How are you?
I'm doing well, Neil. How are you today?
I'm doing well. A bit of background about yourself for our listeners, if you would.
Perfect. Let me tell you. So, Neil, my background, I spent almost a decade at Medtronic, so obviously the inventors of the pacemaker. I was responsible for introducing a lot of their new technologies, such as deep brain stimulation, implantable drug pumps, so a number of their cutting-edge technologies. And 7 years ago, I came to ImpediMed because I thought the technology here was just as cutting-edge and unique.
This SOZO, what exactly is SOZO and what condition is it designed to treat?
SOZO is a device that was specifically designed to look for small fluid shifts that are medically meaningful in the human body. And what we're going to talk about today specifically is for lymphedema for breast cancer survivors.
Lymphedema, is that a type of breast cancer or is it something that's in all of breast cancer?
Great question. So let me tell you, lymphedema is when your lymphatic system is damaged due to your cancer treatment. So whether you have surgery, chemotherapy, radiation, or a combination of all three, you run a very high risk of damaging your lymphatics. And what happens when you have your lymphatics are damaged, they are no longer efficiently moving your lymphatic fluid throughout your limbs, and they start to back up. They become fibrotic, and then you start to see swelling. So you may have noticed lymphedema or cancer survivors wearing a compression sleeve, so a stocking that looks skin-colored in nature, and they have swollen limbs. That's typically lymphedema brought on by their cancer treatment.
Now, is this something that is readily known throughout the medical community as it relates to breast cancer?
You know, Neil, unfortunately, it isn't. The problem that you have with lymphedema is that up until a few years ago, we were able to cure you of your cancer, and lymphedema is just a byproduct. I mean, if you think about it for a moment, if a woman today has a 1 in 8 chance of developing breast cancer, and unfortunately, those who develop breast cancer, 1 in 3 of them will develop lymphedema. And it's really difficult to tell which ones are at the highest risk or low risk of developing lymphedema because all cancer treatment tends to be a little bit different. So today, what they typically do is they'll look for swelling in the limbs of these cancer survivors and then treat them once they start to see the swelling. Unfortunately, by the time they're treating these patients who have swollen limbs, it's too late. That lymphedema is permanent, it's lifelong, it's chronic, and you have aggressive treatment for the rest of your life.
Detecting this lymphedema as early as possible is just as important as detecting the cancer in the first place as early as possible.
That is a great analogy. Like all diseases in medicine, right? The earlier you can detect them, the more effective the treatment can be. So for our device, we can detect it at very small fluid shifts. So we could detect down to 2.5 tablespoons of fluid difference. So if you think about it for a moment, that's not enough fluid to even cause swelling or can be noticed by that cancer survivor. So if you catch it at that earliest stage and you have a simple treatment, a compression sleeve that's worn for 12 hours a day for 4 weeks, we have shown in our clinical study that we can reduce the onset of clinical lymphedema by up to 95%.
Is there any invasive aspect of this SOZO device at all?
No, it's not. Think about this for a moment. Think about a scale with a hand plate mounted on top about waist high. So a patient comes in, they take off their shoes and socks, they put their hands and feet on the device, and we put 256 imperceptible frequencies throughout their body, and in less than 30 seconds we display fluid buildup that's building up in their arms, and so a clinician looking at a breast cancer survivor can tell if they're starting to develop subclinical lymphedema, and then they can intervene if necessary. And if they get routine treatment and get routine tests with our device, then these patients have a high degree or a high chance of never developing lymphedema.
Now, is this detection device only useful in lymphedema situations, or can it detect any fluid changes and maybe alert the patient to some other type of condition?
Today, the FDA has cleared our device both for lymphedema, unilateral and bilateral, and they've also cleared the device for heart failure. So we can look at small fluid shifts in heart failure patients going into fluid overload, and we currently have several clinical studies that were currently underway, and actually several papers that have been published on the usefulness of our device for heart failure patients. We actually got into heart failure because of these large cancer centers who were asking us to use our device for more than lymphedema, and because cancer treatment in some cases can be cardiotoxic, they were looking at a way long-term for monitoring their cancer survivors over the course of their lifetime if they've had large amounts of chemotherapy radiation so that they could detect heart failure at an early stage or fluid overload and treat them effectively as well.
Where can we get some more information about ImpediMed and about lymphedema in general?
We just launched a brand new website for education of patients and clinicians as well. It's www.preventlymphedema.com, and they can get information about the disease state, about our technology, about the clinical trials, and they can request information from us, or we can actually provide them information on a local provider who can actually administer the test for them.
Richard, thank you so much for joining us here on the program, here on Health Professional Radio. It's been a pleasure, and I'm hoping that we'll talk again in the future.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, for this Health Suppliers segment and conversation with Mr. Richard Carreon, Managing Director and Chief Executive Officer at ImpediMed. Audio of this program is available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.